Can you go talk about how the chiropractic work you do is part of that calming need to balance out everything?
Yeah. First of all, the reason you want to get to a calmer state is because you're less reactive with your decisions. You're making better decisions in the calm state than you are in the reactive state. So just if you look statistics, baseball managers look at statistics all day long for lefties versus the righty, and they look at statistics on a regular basis to win the game. So if we want to win the game of life, and you have to have better statistics with your decisions, and your stats will be better in that calmer state. Blood pressure is lower, sleep is better, breathing's better, everything's better. So, how do you how chiropractic care helps with that is by getting adjusted. You're in essence rebooting the nervous system. So it's kind of like getting a kink out of a hose. You're allowing flow. You're allowing the body that is just impinged, creating this chaotic, internal, stressful state to undo and flow more efficiently. And so a lot of patients would say, well, I don't know, is that good for me? Is that, can that help me? And I say in the book, there's different chiropractors do different things, but we're working with our hands. So there's good docs with their hands, and there's other ones. You just do your research on who would be a good referral source from your friends and family would know. But the malpractice for a chiropractor, I said in the book, is 1,500 a year. 30 years ago, I'm only $2,500 a year, and that's kind of, a lot of people don't know that, and I wanted to share that in the book on a malpractice. So the chance of injury is way low according to, let's take it away from what the doctor says and what I say. Let's go to the source that would manage that and oversee that. And for something to be so low, that $2,500 a year, the real estate agents pay more to do real estate deals. So I guess, you look at that. Okay, so now let's look if it's safe. And then, so if you could safe and take someone out of pain, and I find that a lot of these people who are in bad moods and pain coming in, Casper, getting them out of pain and discomfort, they can reset, refocus, recalibrate, recharge to go forward again. So in essence, instead of saying, you need to remove your stress, you need to exercise, you need to get off sugar, it's like, okay, break the cycle for me, doc. Break my cycle that I'm going off. I can't move. My back's hurting, my neck, my knee, my ankle. I can't move to get out of this discomfort. What do I do? So then when you help them with this pain response they're in, then they could reset and say, doc, I went for a walk today. I went for a walk today for the first time in months. I feel a lot better. Great. So then let's start working on your diet now. You feel better. Let's start working on your stretching program. Let's have you start kind of going out in nature more. Let's getting out in the morning. Great idea, doc. So now you become the source of information. And doctor to me means teacher. Is the doctor teaching the patient like a coach should make an athlete better? To me, are doctors making people better? Teaching them lifestyle choices to make them better. Joe Montana's, Michael Jordan's, the Barry Bonds, they made athletes around them better because they performed and had other athletes. They helped them with what they do and what they did, and they made them better. And as a result of that, my job is to, I tell patients all the time, I'm so happy you hurt yourself. And they say, why would you say that, doc? I said, because my job is to make you better. My job is to take your health to another level. My job is to make you better than when you were before, that you didn't even know you could experience. So if I can adjust patients, reboot the nervous system, get pressure off the nervous system, get them to move better, now they feel like doing, Casper, so many other things that can be healthy addictions in their life to move them out of the rabbit hole, which we talked about, instead of taking products to reduce them, and then they become a health statistic. And, oh, Mary was a nice person, but unfortunately she passed on. Yeah, she's a health statistic. And Mary could have saved her life if she went the other route. And then we have all these statistics with no accountability. If I'm that bad in my practice, I'm out of business. So I have to perform every day, like I said. So you get used to performing. You bring people out of the rabbit hole. You break their pain cycle. You get them out of the stress and anxiety state. You teach them how to get to a calmer eye of the hurricane life. And as a result of that, you kind of like see these results. Like, I can't help everyone, but I'd say 98% of the people who come in the office are getting better. And I see up to like 60, 70 patients a day. And I wrote a book on seeing 60, 70 patients a day, which is crazy. I don't even know how I did that with 4 kids who are older now, but I mean, still and working out. And so it's a lot of effort, but, I wanted to share the story so much about, what I saw and share that experience. It's just, and I found I found so many answers when people came to see me, I found answers that they were looking for and that you could help them with and guide them to a better quality of life.
Yeah, and a lot of that guiding happens, of course, not just in your office, but outside, and that's what the book is about.